Say when.
Go ahead. Go ahead.
Okay. All right. So muscular system here. We're going to kind of front to back, superior to inferior. Occipitofrontalis is here. Orbicularis oculi going around the eye. Orbicularis oris around the mouth. Nasalis on the nasal bone. Buccinator is here.
Turn it around.
Going from the corner of the mouth.
Yeah, turn it around.
Sure. How's that? Okay. Zygomaticus major and minor is here and here, going from the cheekbone diagonal. Okay. Temporalis is deep on the side, versus masseter is superficial, going along the jaw. Mentalis here and here, mental foramen. And then sternocleidomastoid and splenius capitis. Sternocleidomastoid's here versus splenius capitis, I'll turn, is deep and running straight up the neck deep to the occiput versus superficial here. Your chest muscles, pec major and minor. You've got pec major superficial, pec minor is superficial, serratus anterior is finger-like going along the ribs there. Abdominal muscle group, external oblique, internal oblique. Your external is here superficial, internal is on the deep side. They run different directions. Rectus abdominis is your six-pack muscle running up and down in the middle. Rectus means middle. Okay? Back muscles. I'm going to spin. And we're superficial versus deep. Your superficial here would be your trapezius and latissimus dorsi. Again, your serratus anterior is over here. We've got, let's see, levator scapulae, goes from the angle of the scapula on up, kind of near the splenius capitis. You've got supraspinatus and infraspinatus. This is the scapular spine. Supraspinatus is above, infraspinatus is below. Rhomboid major right here and here, bringing the scapulas together. So there's your rhomboid muscle. And I've already done latissimus dorsi. Deltoids are going to be here on the outside of the arms. And then I'm going to grab the arm model here. Subscapularis versus supraspinatus, infraspinatus. But, okay. Biceps brachii, short head and long head. The long head is lateral, short head is medial. In between biceps and triceps is the brachialis muscle. And then you've got your triceps, lateral head and long head here. When it comes to biceps and triceps, we'll mark a particular head. So again, biceps brachii, long head, lateral, short head, medial. On the triceps, you've got lateral and long head. Brachialis in the middle of those two groups. Brachioradialis is a forearm muscle overlying the brachialis, going to the radius or thumb side. And then your flexors are your flexor carpi radialis going to the thumb side, ulnaris going to the pinky side. And that's your arm. Okay. To the leg. And yeah, I would come right over here if you can. And let's do hamstring group first. Or now we'll start here, kind of the butt. Gluteus maximus, gluteus medius, and then all the way anterior, tensor fascia lata, which attaches to the iliotibial band. Okay, then your hamstring group, you've got biceps femoris, membranosus, and then semitendinosus. So you've got three muscles there. The front of the leg is the quadriceps group, opposite the hamstrings, and you've got rectus femoris. Rectus means middle of the middle, so rectus femoris is middle of the femur. Then you've got vastus medialis, vastus lateralis, and then your adductor groups. Sartorius, longest muscle in the body, going all the way from the ilium all the way down to the tibia, which helps cross your leg. It's superficial. Then adductor group, superficial is gracilis. Anterior to that, adductor longus, and deep The big one is adductor magnus, is why they call it the magnus. Okay? And then lower leg muscles. We go from anterior to posterior here. And the mnemonic is teach every friend something good. Teach tibialis anterior, every extensor digitorum longus, friend fibularis, something soleus, and good gastrocnemius. Teach every friend something good. Here, okay? And as far as your connective tissues, you've got epicranial aponeurosis, thoracolumbar fascia, linea alba is the tendon of the rectus abdominis. You've got your iliotibial band here, and then calcaneal tendon are all of your connective tissues. And that's it.